Hey guys, it's the doc, and we're doing another. This is sort of an impromptu YouTube live. We had a little bit of a gap this afternoon, so I wanted to jump on here and share one of our newer videos. Again, this is especially for the folks who aren't subscribed to the membership area of the channel, which is where we're posting all of our new content. Uh, I've gone through this ad infinitum in the comment sections, but basically YouTube was restricting my content, age restricting it, which essentially kind of shadow banned my channel, and I just kind of popped off their algorithm. So this was the fix that they proposed, putting any of the age restricted content into a membership area, which unfortunately for a lot of our subscribers who might have some financial restraints and can't join the membership area, they're not getting to see any of our newer content. So we do these lives every now and then just to bring some of that new content to you guys. If you have any questions at all, you can post them in the chat. And let's dive right in. So we'll get into this cyst here. I'm actually watching it kind of for the first time myself, but I'll give you a running commentary. So here we go. We good? So this one was done in my Long Island office. This is my office in Long Island. I have two locations, one in New York City on Fifth Avenue and one in Long Island here. And this is a large scalp cyst. I think we actually did two at the same time in this one. But you can see there's two that are there pretty close to each other. So I usually don't love doing more than one surgery in one sitting, just because if there's a complication or excessive bleeding or something, which is unpredictable. I mean, surgery is always a bit unpredictable. It can throw off the whole day, and then all of the patients after the surgical patient are kind of have to wait, and I always feel terrible about that. But in this case, it seemed like pretty easy to do. So we banged out two in one here. So here I'm numbing them up. Generally, when I'm numbing the patients, the first shot is really the only shot that they feel. In this case, he's probably feeling both of these shots, but I always try to inject my second shot into an area that's already numb. So I post a lot of these like minis. You've been probably seeing them on the YouTube shorts, but on TikTok I post these quite a bit. That's the primary content that I post on TikTok, and folks will always comment, why are you jamming the needle in and injecting so fast? But the reason is because the patient's actually numb already, so they're not really feeling. He's not feeling any of this really, because I'm injecting into areas after they're anesthetized and kind of like advancing the anesthesia forward. So again, that's what we're doing here. So I'm just basically making a ring of anesthesia around these two cysts, and then once that's done, generally I'll just test the area to make sure my patient is numb before making that first incision. You'll find that, and again, this has been something that's been pretty prominent in the comments section, is I'll frequently ask my patients, are you okay? Are you okay? The reason why I do that is sometimes when you get to the deeper part of the cyst, or when you're undermining the skin trying to get the cyst out, some of those areas actually aren't numb. So I ask my patients that frequently because I can always add in more anesthesia during the procedure. So sometimes you'll see me inject during the procedure from like inside the incision. And, obviously that's why I'm asking my patients, because I really don't want them to feel any discomfort. So here I made a small incision. This is the larger of the two cysts, and here you can see I'm undermining. We have the volume, I think, muted on the surgery, right? But I'm probably asking my patient here, you doing okay? Are you feeling anything? Just to make sure that he's not. And if he were to be feeling anything, like I said before, I would inject some anesthesia here. The scalp is very, very vascular, so sometimes that can actually make the surgery a bit more complicated. Some patients just bleed a ton in their scalp, so generally when that happens, we take a little break, we put some pressure on, it's called tamponade, and just kind of wait for a clot to form before we continue the surgery. So here basically I made a small incision. The cyst is actually much bigger than that incision itself. So some of the contents of the cyst are coming out. You can see a little bit of the wall actually poking out too. Actually, no, those are all contents. These are all cyst contents. So once I kind of pop the balloon that's containing all of these cyst contents, then I can tease the wall of the cyst out. So that's basically what I'm doing right here. So we're just working some of the contents out. So this was, even though the contents are kind of soft, this actually was a pilar cyst, which is the more predominant cyst that you'll see on the scalp. Sebaceous cysts, which is actually a terrible term because they're actually not sebaceous cysts, but those are more prominent on the trunk or other parts of the body. So here again, some more of the contents of that larger cyst are coming out. It's got a little bit of the, Vulcan grip going there, some pressure to get some of those contents on. There you can see now the wall of the cyst is starting to come out of that incision that I made in. There we go. Cyst number 1 is teasing its way out. The reason why they don't just pop out is because generally, like, your body will make like a little fibrous sheath around the wall of the cyst, and that can hold the cyst back and kind of in place. So I'm actually cutting away that little fibrous sheath here so I can get the wall of the cyst out here. You actually see a little bit of it down there when I'm snipping it away. And there it is. I think there's a little piece of it left there, which we'll grab out. All right, so first cyst is done. And now we're going to move on to the second one. Another question I also get is, why don't we shave the area? If I were to shave this patient's head, he'd have like a bald spot there for weeks, and cosmetically it'd be very disfiguring. So I never ever shave. We clean out pretty well after the surgery, and I just advise my patients to go home and rinse their scalp out. It really has no effect on the surgical site itself, and that way my patients don't have to walk around with a bald patch on their head. All right, so here we go. There's a second cyst down there, so I'm making an incision there to get that guy out. So we'll make a little elliptical incision here because that actually allows the skin to approximate very well once we're done with the surgery. If I were to make a straight line, there'd be extra skin that's there. So we take a little bit of extra skin in the form of an ellipse so the skin can approximate more appropriately. So same principle here. I'm just basically trying to squeeze the cyst out. Sometimes they pop up intact like this one. This one just popped out. And sometimes the wall ruptures, but this one, you can see a little tiny rupture in the wall, but the contents more or less stayed inside the sac of the cyst. And there it is. There's a second cyst. So 2 for the price of 1. So at this point, just going to suture the patient up. What I always tell my patients is basically we removed something from their scalp that was occupying space. So your body naturally will try to fill that with blood and serum. And my patients can sometimes expect to see, which is normal, a watery, bloody discharge for a few days. Generally, it's in the first day that's the most prominent. And then after that, your body will just kind of fill that void in with collagen, which can actually take many months for it to fully repair underneath the skin. So sometimes you can feel a soft spot or like a little divot when you're pushing into the surgical site, which is all normal. It can take 6 months, even a year sometimes, for the body to repair itself underneath the incision. But generally on the scalp, it doesn't really, for the patients themselves, it doesn't really matter much from a cosmetic perspective because no one sees it. It's only something you can feel if you're palpating your scalp. So after the sutures are placed, sometimes you'll see me use a scissor between the stitches. And what I'm actually trying to do is I'm actually trying to pull hairs out from between the stitches. I mean, invariably on the scalp or a hairy area, some hairs can get trapped underneath the stitch. So I'm just releasing those hairs that are trapped underneath the suture. And then generally after the procedure, my assistant stays back in the room, cleans things up, and also just make sure there's no discharge from the area. Usually if there's any bleeding, it happens like right then and there. Once everything is stable and the patient's no longer, there's no hemorrhage or anything like that from the wound, then they're safe to go, which can be like just a few minutes, 5 or 6 minutes after we're done with the surgery itself. So here's what I was talking about earlier. I'm just trying to get some of the hairs that are stuck out from underneath the sutures, and that's a wrap. So this patient did very, very well. Came back in 2 weeks. We took the stitches out. I always check anything that's removed from the skin. We always check, send it to pathology to make sure we're not missing anything. Both of these were completely benign, harmless cysts, and he did very, very well. So that is, what was this one called? Two for one or something like that?
Double trouble.
Double trouble. This was a cyst called double trouble. So again, this one lives in our membership area. If you do want to check it out, it's living in there and you can watch it. But like I said, we'll periodically be posting content like this, some lives, so we can bring some of our membership content to folks who aren't able to be members. So I hope you guys enjoyed it. This one will live on our channel, so you can watch it, and have an awesome weekend. Let's get it.
There's like a one comment from someone.
Oh, there's a comment that just popped up. I can't see it.
It's gonna come up.
Okay,
Just give it a few seconds.
hold on. I'm just waiting for this comment so I can respond. Do you see
You
it?
can see it here.
Eileen Bayer. Thanks, Eileen. I appreciate it. Again, we have a lot of new content that's living in our membership area. If you want to check some of that out, but obviously, if you're not unable to do that, just stay tuned. We're going to be doing these every few weeks or so. We'll be posting another live video where we can bring some of our newer content to you. So, thanks for that comment, and I hope you guys all have a wonderful rest of the weekend. And I'll see you at the next live. Have a great one.